Hi, I'm Dr. Shivadev, Psychiatrist and Sexual Health Specialist. I have about 16 years of experience in dealing with psychosexual health and mental health too. My clinic is in Koramangala. I'm a co-founder of PassionFruit Top-Notch Wellness. Routine STD testing is recommended for someone who's starting new or with already multiple sexual partners. If you are engaging in a long-term monogamous relationship and has had previous sexual partners, it's important to get tested first. Let's explore what some of the common tests are. Some are done through bloods like HIV, hepatitis, HSV is commonly detected through blood tests. Urine tests and swab tests for gonorrheas and chlamydia are usually helpful, and HPV is assessed. Pap smear testing for HPV in women is usually effective in detecting if they have HPV. So blood tests, urine tests, swab tests, as well as pap smear tests are most common methods in which we can test for STIs. Self-tests for STIs often exist and are helpful for a starting point, but they may not be following the proper procedure, or sometimes you don't know how to interpret it, or they may not be as accurate. WHO 2022 recommends that it is important, and clinical testing is the gold standard for testing with STIs, and not only because of the testing and the accuracy of the labs when you do it in the clinic, but also this is followed up by proper understanding, interpretation, and you're sitting with a clinician to understand what you have and what you don't can help you to get a proper understanding and alleviate anxiety too about it. Sexual practices and risks of infections can be categorized into high risk, medium as well as low risk. The highest risk is when you are engaging in a penetrative intercourse or anal intercourse or vaginal intercourse without protection. That carries the highest number of risks. Moderate risk can also be because when you are engaging in oral sex, and oral sex can also transmit herpes, HPV and gonorrheas. And the low risk is when there's a lot of fondling or just surface to surface or kissing, etc., which also can spread some kind of STIs and infections too. So how often should I get treated is depending on where you stand and how often and what kind of sexual practices you have. If you are someone with multiple sexual partners, I definitely recommend getting tested every 3 to 6 months. And in some special populations, like if you are a commercial sexual worker or a sex worker or men having sex with men, it should be more frequent, probably every 3 months once.